So they have all these other reasons why they develop the sore, and then they have trouble healing it after that.
And what about this? One of the things that complicates this is that because people can't feel their feet, they don't check their feet like you and I do. If we're on our feet all day, our feet are sore, we come home, we rub our feet, it feels better. We can look at them and notice something. But people with diabetes, they have that numbness, they don't feel it. So if they've been on their feet for a prolonged period of time, they don't go home and do that, and so then they miss things, right?
Exactly. That's exactly what happens. And the other scary thing is that diabetes can damage eyes, too. So not only may the patient not be able to feel what's going on, they might not be able to see what's going on, and there could be a sore developing. The other thing that can develop is, we hear a lot more about sores, I think, but the other thing to remember is that a fracture may not be felt as well by someone with severe diabetes, with severe nerve damage. So the bones can actually dissolve in the foot, which can lead to a lot of deformity, lead to further ulcers, and that can be a very devastating situation.
One of the ads that we put up just a few minutes ago talked about amputations.
Yes.
And it's a very serious sort of end of the line kind of therapy, but how are those prevented, and how do you decide when something gets so bad that you have to amputate a foot? Because it's a serious problem.
Right, it absolutely is. Prevention of these types of things are certainly being screened regularly by a podiatric physician. It's very important. Some diabetics do need vascular studies every year too, just to monitor, because if the vascular status to the foot, the circulation to the foot is inhibited, that can be devastating and lead to problems such as gangrene and ulceration.
It's a vascular study for our audience.
It's actually really painless and it's quick. It's almost like getting your blood pressure taken, and then a Doppler is an ultrasound, and that's used to listen to the arteries going to the foot, compare them to the arteries in the leg, in the arm, and then we can determine a lot about the patient's ability to heal wounds with that information, and see if the patient would need what's called a bypass procedure. Everyone hears about bypasses for the heart.
Right.
Arteries going down to the foot can be blocked too, and sometimes a procedure is necessary to go around that blockage, either with angioplasty or moving the blockage away, or actually bypassing around it, and that can help save a limb.
Yeah.
So usually podiatrists will work with a vascular surgeon or vascular specialist as a team approach to try to save these limbs.
And there's sort of gradations too of amputations. Sometimes you can save toes or part of the foot, and that can make a big difference. It's not It's certainly not a great diagnosis, but it can make a big difference compared to taking out the whole foot or going up the calf, right?
And as podiatrists, we try to save as much as we can, because studies show that if a patient suffered what's called a below-knee amputation, the odds are that they will suffer the contralateral or the opposite limb amputation within 3 to 5 years. And the mortality rate for these patients is not very good.
Right.
So it's the 6th leading cause of death in the United States, diabetes is. And it's because of things like amputations, kidney damage, and heart disease. Yeah,
and the message for all the viewers out there is, if you have a vessel problem in your leg, you probably have it elsewhere in your body too, don't you?
Exactly.
It's a marker for problems elsewhere
Absolutely. And patients who do suffer an amputation, it's very hard on their heart. If we're not able to save part of the foot, trying to walk around with a prosthesis is hard on the heart.
Yeah, exactly. So how does someone determine whether they need to see a podiatrist, and how do they figure out whether they have a problem that may be diabetic in nature?
Any patient with diabetes, I do recommend seeing a podiatrist at least once a year. Every time you see your primary care physician, you should take your socks off. Inspect the feet daily. If any corn or cut that's not healing seems a little strange, if the foot is hurting, if there's redness, it's certainly time to see a podiatrist. Some patients need to be seen as often as every 6 weeks, just for maintenance of corns and calluses. Toenails can cause a lot of problems with patients with diabetes. If the nails are thick or have fungus in them, that can be a source of developing a sore as well. So it's not just a cosmetic issue, fungal nails, especially for people with diabetes.
Right.
And certainly if you have suffered an ulceration or an opening, then it's very important to be seen by your podiatrist even more regularly.
Yeah, that's great. Next month, the Illinois Podiatric Medical Association is going to sort of raise awareness during Diabetes Awareness Month on November 18th, our annual statewide call-in event. basically volunteer podiatrists will gather at the IPMA headquarters. We'll have our 800 number, which you guys all have memorized by now, right? 888-869-FEET. It's a clever little phone number there. And we'll say that later. It's also on the sign here, of course. We'll take calls from anybody in the state who has a foot problem. The last 2 years, a quarter of the calls that we've gotten have been about diabetes, which I think is very, very significant.
Absolutely.
And the kind of calls that we get are very interesting. And we will give referrals to podiatrists in your area. No matter where you call, we'll give out 2 or 3 names of IPMA members near you that you can go visit, that you can call and make an appointment. And hopefully it'll make a difference for some of these people.
Definitely. Diabetes is an epidemic, unfortunately.
Yeah, it is one of the biggest public health threats that we face, and podiatrists are on sort of the front line, really, in terms of seeing the problems and what kind of sort of catastrophic, really, health consequences that this disease has.
Absolutely.
We have just a couple seconds left. Talk a little bit about some patients that you've seen recently. We certainly don't want to mention your names, but you mentioned a couple obese patients that you were treating recently, and I thought there was a really kind of a moving story about the kinds of challenges they have to overcome and how you treat them.
Right. Once an ulceration develops, if a patient is already obese, usually one of the first things we do as a podiatrist is get them off that foot to allow it to heal. But then they can't exercise, so then the weight comes on and it becomes this endless cycle, and it can be very difficult to treat and to heal a wound like that. Can be very emotional for the patient because it's devastating to have to do dressing changes every day, especially if it's difficult to reach your feet. So that's why we like to intervene before that. Statistically, a patient who is seen by a podiatrist regularly is far less likely to develop an ulceration and far less likely to develop an amputation.
That's great. That's a great take-home message, and that's what this show is all about. We talked about some scary things, but really it's about prevention. Get in to see your physician, call the IPMA headquarters, and get a referral to a podiatrist near you, and hopefully you can prevent some of the things that we talked about.
Yes.
All right?
Thanks, Chris.